Hi Richard.
Hiya.
How are you doing?
I'm fine, thanks.
My name's Rhiannon. Do you remember me from last time?
I do, yeah.
Yeah. How are you getting on?
I'm okay.
Yeah, not too bad. Great. So what we're going to do in today's session is we're going to just run through a bit more about sort of what our physio role is in sort of the long-term condition which you've got is Parkinson's, and then we're going to go through a bit sort of what management strategies we can try and help you sort of use so you can be a bit more independent and manage it on your own a bit more, instead of sort of feeling like you've got to come to us when you want to do anything.
Yeah.
All right. So last time we had a little bit of an assess about sort of your movement, things like that, what you've been finding difficult. We had a look a bit at your like problems, and a bit of a problem list for you, sort of things we can do with some goal setting, things like that. Alright, so what we're going to do today is try and aim to sort of address some of those so you feel a bit more confident that you've got things in place to help you sort of feel a bit more independent and things like that. Alright?
Yeah.
It's just a bit more about sort of like the physio role itself. And obviously we sort of assess your function and your movement and things like that, just sort of get an idea about what your problems are and where you're finding a bit more challenging. And then we sort of try and come up with strategies and easier ways to move to try and help you sort of do sort of your more daily living function kind of things.
Yeah.
I know you said you had some problems sort of moving in bed, sort of getting in and out of the chair, like your wife just having to help you quite a bit, yeah.
Yeah,
obviously,
back pain.
yeah, so obviously we want to try and prevent that kind of becoming any more of an issue for either your wife or yourself.
And that would be great.
Yeah? Okay, so obviously Parkinson's is a degenerative disease, so it's obviously over a long period of time. So what we want to try and do is try and get some strategies that can help you for the short term, but obviously that work long enough so that you can have them for the long term as well. So obviously we want to sort of work with you to see what works best for you, and then we'll try to implement them. And if they don't work, we can try different things and sort of different aspects to try and improve sort of your function at home independently.
Okay.
Alright? We're going to try and sort of limit the intervention from sort of the healthcare professionals as much as we can, but obviously when you need our help we are there for you sort of to talk to us or anything. What I would be quite interested to do is just to get your Parkinson's nurse involved and also maybe an OT as well, just because I know you said you're having some problems with like your on-off medication a bit and you didn't feel like it was as effective as it was previously.
No.
Right, so what we might do is we might either self-refer for a time that's good for you, or I can pass on a referral for her to come and see you, and then you can sort of sort out a bit more sort of your medication times, adapt it a bit to see if anything or any different types of medication might need a review or something.
Okay, that sounds good.
Yeah, and also have you heard of occupational therapists?
Yes, I think I have.
Yeah, they focus more kind of like on the activities of daily living in your home and sort of like cooking, dressing, washing, that kind of thing. So what we might do is get in touch with them and see if there's any like equipment that they can give you or anything like that that you might be sort of struggling with. But if not, if you don't fancy it, then that's absolutely fine. Just for something that you might feel sort of is appropriate. Yeah. Alright, just to sort of maintain your independence, make sure you can do things but comfortably and safely, especially and your wife as well. So just sort of at ease for you both. Alright. Just kind of a couple of things to flag up, sort of the interventions that we're looking at, the two sort of drive home things I want for today is queuing and exercise. So what we're thinking is, because obviously you've been freezing a little bit, and then if you have quite a few falls in the past 6 months, haven't you? Yeah. And that's obviously quite a concern for yourself and also sort of professionals like us who want to prevent that from happening. Because obviously, as you can probably understand, if you have a fall, you've got more risk of having a fracture or sort of bumping your head or sort of any things like that. Yeah. So what we want to try and do is try and reduce that, and a way that we can reduce that in Parkinson's is something called queuing. I don't know if you've heard of it. Basically, it's sort of, you can use it auditory, visual, or smarter sensory, so it's like on the skin kind of thing. And all it does is it provides a cue just to restart your walking pattern. So when you feel like you're freezing and you sort of feel a bit glued to the floor, all it does, so for example, the auditory one's like a metronome, so it's like a beep on a rhythmical beep. And all you have is you put your earphones in and then you try and heel strike to the beat. And how that works is because of Parkinson's disease, you've got a blockage in sort of a pathway from the brain to the sort of trying to get the messages to your foot or to start walking. And all it does is it just finds another way around the blockage so you can restart the walking pattern. So that's all the cueing does. It just aims, it's nothing invasive or anything. All it is just either a beep, or in visual sense, you've got lines on the floor, or you can have like a laser pen to try and follow. So especially for you, obviously the gardening is quite a big it's a big issue for you. So what we're thinking is maybe have some tape on the floor for you. So what you're able to do with the tape is trying to step onto the tape and so that's trying to restarts the pattern when you feel yourself freezing. So obviously I know changing direction is quite difficult for you.
Yeah, I struggle with the turn.
And especially in tight spaces as well, like your greenhouse, it'll be a bit of a problem. So what we'll try and do is we'll try a couple of them with you. We can try all of them, we can try sort of one of them if you find you really like one more. And if we can just kind of keep going through them as it kind of is up to you. So we're really kind of aiming for it to be like based on what you fancy and kind of what works for you.
So a bit of trial and error.
Yeah, definitely. A bit of trial and error and see what works. And if one works for a while, then stops working, we can try other things. Something to take away from it is if you don't like some of the visual things, but they do work for you, sometimes people can sort of memorise them as they were, they can imagine it. It becomes more like an internal thing, so you can sort of imagine the dots on the door, or you can imagine the lines on the floor, or your wife could start counting for you, or you could start having a song in your head, or a beat. Yeah, so that's something that you could sort of take away sort of as a long-term strategy if that wasn't something that you'd like kind of in your house forever, obviously. Alright?
Yeah.
And obviously the aim for that is to kind of increase your activity levels. I know you said you had a bit of a low mood because you're not sort of getting out and
It's
about
getting
as
me down
much.
a bit.
Yeah, so obviously, hopefully with a bit more independence, with sort of reducing your freezing, you feel a bit more confident to go out and about with your wife and things and walking around, so get a bit more exercise and things like that. Which brings me nicely on to our next point. Obviously you probably know that exercise is a really big thing for Parkinson's disease.
Yeah, I do.
And obviously you need to make sure you're exercising sort of a considerable amount. Obviously you're quite active anyway, which is absolutely fantastic. Obviously you want to make sure that you kind of keep doing that. So what I was going to suggest to you is we can either do a home programme for you, or we can set up, you go into some classes regularly, so like an 8-week kind of programme for now, and then maybe you could carry it on yourself or find another hobby that you might enjoy. That's just to kind of increase again your independence. I know you've been suffering some like stiffness, and you say your posture's got a bit worse since the last couple of years, and it's all kind of just declined a little bit, and you're getting quite stiff and things like that. So hopefully with the exercise program, aim to increase like your flexibility, the strength in your legs, sort of all the transfers, and things like that. So hopefully that will increase your independence and get you back to things like gardening.
Yeah, that would be
Alright,
great.
yeah. So if we try and put those all into place, then hopefully that will give you a bit more independence. You feel like you're managing it a bit more.
That's great.
If you've got any questions at all, don't feel like you can't talk to us. We're still here. So.
Okay.
Alright,
Thanks very much.
fantastic, no problem.